Welcome to Newsmax TV. I'm Ashley Martella, and we're pleased to be joined by the chairman of the House Republican Conference, Indiana U.S. Representative Mike Pence. As you probably know, he's a vocal critic of Obamacare, the Democrats' so-called stimulus package, cap and tax, and the massive bloated federal budget. Welcome again to Newsmax, Representative.
Well, thank you, Ashley. Great to be back on Newsmax.
First of all, we enjoyed that spirited exchange you had with House Majority Leader Steny Hoyer and the fact he had you voting in the House 7 years before you even arrived.
Well, you know, as they say in NASCAR, rubbing is racing. And I was awful proud of 134 House Republicans went to the floor yesterday to take a stand against a $1 trillion tax increase to pay for a government takeover of health care in the midst of the worst recession in 25 years. Republicans took to the floor. It ended up inspiring the Democrat Majority Leader to come down and take us on, and that gave us encouragement that our message was reaching not only the American people, but reaching our colleagues in the House.
Also made for a great YouTube video, by the way. On a serious note, though, Representative, the healthcare overhaul that Obama and his comrades in the House want to pass so desperately, so quickly, would the House bill make healthcare more affordable and accessible for everyone, as Obama claims?
Well, as the experts on the outside of Congress are saying, what we're looking at in the Democrat plan is a government takeover of health insurance in this country, financed by $1 trillion tax increase. The result will be tens of millions of Americans will lose their health insurance, and even millions will actually lose their job as businesses face higher costs. And according to those independent experts, not only will it have that effect on our economy, but also it'll do very little to reduce either the cost of health care to the federal government or the cost of health care to Americans. Republicans support meaningful health care reform, Ashley. We believe that we can bring greater competition within the private marketplace of health insurance in this country. We simply don't need a new government-run program that's going to drive tens of millions of Americans into a government health care system.
When asked by a liberal blogger if people will be able to keep their private insurance policies and whether those companies will be able to write new policies, Obama responded that he wasn't familiar with that part of the bill. What does that tell you?
Well, look, I want to be fair to the President of the United States. There are different bills in the House and the Senate. I'm not so much worried about what the President doesn't know is in the bill as I'm worried about what the President does know is in the bill. This administration is insisting on a government-run insurance option as the centerpiece of their health care reform proposal. And while the President in that same interview continues to say that Americans who have their health insurance will be able to keep their health insurance, common sense says otherwise. The truth is, there isn't a small business owner or family farmer in this country facing difficult economic times who isn't going to seriously consider terminating the health insurance benefits for their employees the minute that Uncle Sam offers health insurance to every American. The President can make all the promises he wants, but the truth is you can't keep your health insurance if your employer cancels it and sends you to Uncle Sam. And that's why we're more concerned about his continued insistence that a government-run insurance option be at the center of this Democrat plan.
All right, critics note the fact that government-run health care necessitates the rationing of treatment with the elderly, the most vulnerable. Please comment on that for us.
Well, there's no question that that government systems, bureaucratic systems, by definition, operate under a system of rationing. You need look no further than Medicare and Medicaid's budgets, or talk to a local hospital administrator in your hometown about the subject of reimbursements to know that when the federal government takes responsibility for an area, even as precious as health care, they tell you not how much they can do, they tell you how little they can do. That's another way of saying rationing. But there's no question in my mind that as the government under the Democrat and the administration's plan vastly expands the role of the federal government in our health care economy, it will lead to rationing, and ultimately it will drive us intentionally or unintentionally to a single payer system and to socialized medicine in this country.
Do you have enough support from Blue Dog Democrats to stop this nationalized health care, or will Pelosi and Hoyer take them out to the woodshed, as it were?
You know, I don't know if we have enough support among Blue Dog Democrats. I know that Speaker Pelosi told a news organization this afternoon that she had the votes. And now that may be posturing, I can't say. But whether there's enough votes here in Washington, D.C., I know there's enough votes out there. The millions of people that visit Newsmax every day, the tens of millions of Americans who cherish their own private health insurance, who cherish the free market foundation of our healthcare economy, have the votes. And if the American people will rise up as never before in the next 7 days and contact their member of Congress, especially if Democrat members of Congress who profess to be conservative, it can make the difference. We can stop this massive government takeover of our health care economy, and we can move this Congress and this administration towards some modest reforms that will lower the cost and improve health insurance in this country.
All right, there were 8 House Republican defectors when the Waxman-Markey cap-and-trade energy tax narrowly squeaked by. Will your party stand united this time when Obamacare comes to a floor, or might there be some apostasies then too?
Ashley, you're going to see overwhelming Republican opposition to a government takeover of health care and this $1 trillion tax increase. And a government-run option is such a bad idea on so many levels, but there's also the piece that this administration made it clear over the weekend that they're not going to rule out funding abortion in a new government-run insurance plan. I think those issues about limited government, about taxation, about traditional moral values are going to result in an overwhelming level of Republican opposition. So stay tuned.
Indiana U.S. Representative Mike Pence, thanks so much for spending some time with us here at Newsmax.
Always appreciate it, Ashley. Thank you.
And thank you for watching Newsmax TV.
Homeland Security advises every family to have an emergency radio. It's essential for severe weather, power failures, even terrorism. Now Newsmax is offering you an emergency radio absolutely free. Just pay shipping and get the radio, plus a free trial subscription to Newsmax magazine. Go online to Newsmax.com to check out the details of this great offer. Get your free emergency radio today. Just call 800-NEWSMAX. Make sure your family is protected. Call now, 800-NEWSMAX.